My name is Elise Morris. I'm a consultant surgeon working in general and colorectal surgery here at Conquest, and I'm one of a team of 10 consultants working together in surgery. We have 17 middle grade posts, and 6 of the middle grades are training registrars from the KSS deanery. So we also have 4 core trainees attached to all the surgical specialties, and at any one time 2 of those will be attached to surgery. So the usual working day starts in the surgical library with a handover meeting where the team that has been on call overnight will hand over to the day team, and the members of the ward team would also go along to that meeting so that they can hear about any changes that have happened overnight and make a plan for the day.
Hello, my name is Tian. I'm one of the core surgical trainees in general surgery department at Conquest. We're at Discala ward at the moment, and it is one of our surgical wards. Every morning, consultants come to do a ward round, and we'll have a team debrief with all the nursing staffs. All the patients will be reviewed and have their management plan sorted, and that's how we start our day here.
My name's Will. I'm one of the FY1 doctors on general surgery at the moment. I suppose a typical day consists of getting in just before 8 o'clock to update the patient list, and then doing a ward round with usually one of the consultants or sometimes a registrar, seeing all the patients, taking blood, ordering scans, discussing patients with other teams if we need to refer. Certain days we're on call on the SAU unit, which is a rewarding experience. We get to clerk patients in, see patients as they present, and then from time to time we're able to get to theatre or go to outpatient clinics and see what the consultants do on a more regular basis.
Hello, hi, my name is Radhika. I'm one of the surgical registrars. I'm ST3 in general surgery at the Conquest. It's a shared site between Eastbourne and Hastings. If I'm on a regular day, I would start at 8, or sometimes slightly earlier. If I have a theatre list, I would go and consent my patients, do a ward round for my regular patients on the ward, and then proceed to spending time in the elective theatre list. After finishing the elective theatre list, I would go and see my post-operative patients and make sure my foundation doctors and SHOs are happy on the ward before I leave. Apart from theatre lists, which are elective, you could be scheduled for clinics. The clinics are actually between 3 sites, so it could be at Hastings, it could be in Bexhill, or it could be in Eastbourne. A few theatre lists do exist in Eastbourne. They're day surgery lists, so they're usually quick turnaround and they go home the same day.
I suppose the core responsibility of the ward F1 doctors is looking after post-op patients, so patients who've come in often for cancer surgery, and ensuring that they recover as well as they can after their cancer surgery. We also see patients who are admitted via the SAU unit, so emergency presentations like appendicitis or diverticulitis, and look after them once they're on the ward and help them recover as quickly as possible and get home. There are about 10 or 11 of us on the rota, but taking into account 0 days and nights and annual leave, there's usually about 6 or 7 of us, I suppose, on the ward at any one time. Whilst the consultants and registrars are in theatre a lot of the time, do feel well supported, and it's a very friendly department. Both wards over here and the SAU over the corridor are a friendly environment and well supported by seniors, so it's a good job to have as an F1 here.
We've got colour-coded teams that everyone works in. We have red, blue and green teams. This is so that patients are easily identified by colour groupings. Each consultant is assigned to a colour grouping, as are the registrars, CT and F1 trainees. So each colour group is easily identified on the ward round by looking at the patient boards, and you can see that on each ward the names of the patients will be written up in that individual colour.
So I'm Ben Woodward, I'm a CT1 in general surgery. Our on-call would start with a handover first thing in the morning, then followed by a ward round of SAU of all the patients who have been admitted the night before or perhaps over the weekend. We then spend the day answering bleeps, seeing patients in A&E, seeing patients on the ward who need reviews, and going to theatre with the registrar to either do cases ourselves or to assist them. When we're not on call, we can divide our time between either going to clinics, going to elective theatre lists. We help the F1s out in the morning, make sure that everything is okay there on the wards, and we do the ward rounds with them. And there's also the opportunity to go to minor ops lists where there's kind of skin lesions and things like that that we can operate on ourselves, and the consultants there to kind of check everything's going okay, but they're pretty much our lists really.
Core trainees in general surgery don't do night shifts, and although this may mean that they don't get experience during night on-calls, what they do get is excellent elective lists and good theatre numbers, and they cover the emergency day on call, which gives them good exposure to CPOD and the on-call clerking.
The way that our on-call system works is that the team is based in the surgical assessment unit 24 hours a day, and the consultant is freed of all other commitments and so is solely devoted to the on-call duties, which means that they are readily available for operating and to assess patients quickly, but also to give training.
With on-calls, every single consultant is on call from Monday to Thursday, and then another consultant will come from Friday to Sunday. When the consultants are not on call, they will come to the ward and see their patients. And we've got plenty of support from the nursing staff. There are 4 senior SHOs on the ward. We pop back to the ward every now and then to ensure all the foundation doctors have enough support.
Today I'm on call for general surgery. That means that my day starts at 8 in the morning, where I attend a handover. And following on from that, we take on a ward round on surgical admissions unit. After the ward round, we either see new patients, or if there are any patients who need to go to theatre, we would start in the emergency theatre for those. Night handover starts at 8 in the evening, so towards the end of the day I'll start preparing a list. And it's just a registrar and a foundation doctor overnight, and the consultant is available throughout the night over the phone, and if necessary would come in. I've had excellent support from my team to attend my own personal teaching sessions, which are held in London at St Mary's, and also Kent, Surrey and Sussex teaching days, which are spread throughout the deanery.
There are regular teaching sessions in the department, and we regularly run an academic meeting on a Monday between 1 and 2, and that is held in our surgical library, and it runs using case presentation, journal clubs, and we also have some visiting specialists come in just to talk about areas such as assessing the critically ill patient or the diabetic control, pain relief, that sort of thing.
One of the key learning opportunities is in theatre. The consultants and the theatre staff are very supportive of junior trainees, and there is a real environment for learning and teaching.
So the fact that we don't do night shifts at all, it means that we actually spend a lot of our day shifts when we're on call going to emergency admissions and seeing operations that we wouldn't see overnight. When we're not on call, we get to pick and choose to a certain extent which lists we go to, so we can see which operations they're likely to be doing. If there's things that we can assist them with, or there's things that we can do ourselves, we can obviously prepare for that. Otherwise, there are lots of different clinics that we can do over the course of the week. So it means that by the end of the rotation, we've actually seen a little bit of everything.
It's good to see surgical patients and get to know and assess stomas and hernias and things like that. And you get to see acutely unwell patients on the SAU as well, which I think is probably quite different to other hospitals and surgical departments. So I think, yeah, educationally it's rewarding, and there are opportunities to go to clinic and theatre as well to make the most of it.
We have become an approved centre for running the regional basic surgical skills programme. That is a compulsory course for all trainees wishing to pursue a career in surgery, and it's run over 2 days. So it follows the college's format. We run that twice a year here at Conquest in our simulation lab here, in our skills lab. The opportunities for feedback are at the end of ward rounds, when people have come along to clinic, or during and after theatre sessions. Those are the most easy access points, but we are always available. But we will also be available to give more structured feedback at times leading up to their ARCP, for example. We like to hear how we're doing as well. We like to hear about things and suggestions that they have that might make things better for successive trainees.
Hello, welcome. My name's Debbie. I'm matron on D-Sham ward. We're high risk surgery. My sister ward is Gardner ward, and Jacinta Isles is the matron on there. We welcome you. If you're writing in the patient's notes, you must sign the log, and we have a notes trolley that's locked. At all times it's locked when you're not using it. Use your notes, put them away afterwards, lock the notes trolley behind you. If you do this, we'll all get along wonderfully, and we're here to help. If you don't know, please ask.
We have quite an innovative approach. So, for example, recent projects have included working with physicians, doctors' assistants on the surgical assessment unit while people are on call, but also supporting a surgical first assistance, which would potentially free training time in some operating lists.
Hi, my name's Mika Henderson. I'm the Trauma and Orthopaedic Administrator. I also mirror the surgical administrator's role in surgery. Our expectations as administrators are that we send out your rotas 6 weeks in advance. Equally, we like to have 6 weeks notice for any leave that's taken, so annual leave, study leave. This is all coordinated by the administrators. Anne Lightfoot, the surgical administrator, is based up in the surgical corridor, which is by the surgical wards. So we're very accessible. You'll always see us walking around, and we're always happy to help with any queries, any problems. I hope you'll enjoy your time in surgery, and we look forward to meeting you all.
In terms of guides, there is a handbook which the Trust gives, which has antibiotic guidelines and the local Trust policies. I also use my own textbooks, so I'm using Kirk's General Surgical Operations for surgical procedures. But in terms of other books, I would recommend, for the junior trainees, I would recommend Surgical Talk, which is an excellent book.
Microguide is very useful. I'm on that all the time. There's also an app called Induction. Induction's a very good app for literally just you type in the hospital name and it has a list of all the bleep numbers, all the contact numbers for the hospital, so I find that quite useful as well.
This is the main desk, and one of our key handovers are done through an electronic list. It's found on eSearcher, which is one of the key programs we have that we use for blood tests and imaging. And that's where we keep our electronic lists as well. If you get any referrals, they go in a purple folder, which is kept up to date by the nursing staff and also the doctors if they receive any referrals.
At one of the surgery registrar's training days for KSS Deanery, a vote was taken, and the Conquest Surgical Assessment Unit was both voted as one of the best places for surgical training in the KSS Deanery, and one of my colleagues, Mr. Harshen, was voted as the best trainer. But I think as a group, the feedback that we have had is that on the whole, trainees find us very supportive and approachable, and we do our best to make sure that the time that trainees spend with us in surgery at Conquest is productive and useful.
Yeah, it's a very educationally rewarding placement. We get opportunities to go to theatre and clinic as much as we can if the wards are covered, and learn from the consultants there. We get opportunity to clerk patients in the SAU and see them presenting acutely, which I think compared to a lot of other hospitals is probably fairly unique for an F1. And I feel it's well supported by seniors and a really enjoyable placement to have here.
This is a great place where you get a lot of theatre exposure, be it elective or emergency. And because of this, as a core or a surgical trainee, your logbook numbers will automatically shoot up. So that's something that I really wanted, and I'm glad to say that that's worked out for me.
We always welcome new faces. I think we find it a friendly, enjoyable place to work, and we'd like to share that with you. So we'd like to welcome you on board and look forward to meeting you.